What's up, guys? Dr. Webb here, orthopedic spine surgeon. So something that I've learned over the years being in practice is the power of professional identity. And this is really something, as a physician, how do you carry yourself? How do you manage certain situations? These are things that are not necessarily taught to us. So today I'm speaking to some students here at UTSA about professional identity. This is one of the things I love to do is give back, talk to the students, a lot of mentorship. So should be a great talk. All right, this is pretty surreal because I graduated from UTSA, this school, a long time ago, about almost 20 years ago.
Damn.
Makes me feel kind of old coming back 20 years later to speak to the students, but yeah, this is where I graduated from college. This is Dr. McCormick. Yeah, we didn't have all this. We didn't have a football team when I went here. I graduated a long time ago, 20 years ago. Good, thank you guys for having me. Like I said, 20 years ago, almost 20 years ago, I graduated from UTSA, and it's certainly changed a lot. I'll jump in, I have a few slides. I mainly want you guys to ask questions. Professionalism, resilience, compassion for yourself and also patience. You have to be able to care for yourself. You can't take care of others if you don't take care of yourself, okay? And then you have to share and normalize your struggles. It's hard. This whole journey is challenging. It's hard, but I always tell myself that if other people can do it and thousands of other people have did it, I can do it also. And if I can do it, you guys can also. So it's gonna be some days that you wanna quit. Of course, throughout this whole journey, I was like, man, why am I doing this? In the long run, I think it's certainly worth it. There's no other profession I can think of that I would rather be doing, even though, what was it? It took me 7 years to get my college degree because I was in the military, I was active duty, and I was working at nighttime, and then going to school on the weekends, internet courses, and I took some classes here and graduated from here. So this whole journey, the medical college that took 7 years, medical school, residency is 5 years, fellowship is 1 year. So this whole journey, it's going to be hard, it's going to be challenging, but it's certainly doable. And all of those sacrifices that you make along those years, it pays off in the end. So a lot of things I want to do at this point, you know, I can do because I've put in all the work initially. From a financial standpoint, there's really not anything that I wanted to do from a financial standpoint, or buy some expensive car, or go buy this house, go on this vacation. I can do it now because I've put in all the years and the time and the effort. And that's not the only thing that we do this for, but that's certainly, you know, if I go to school for 15 plus years, I want to be compensated for that. So for your knowledge and your expertise also. So I think balance makes you a better doctor. If you're 100% doctor, medical school student, you don't have any outside hobbies, you're going to burn out. So you have to have things outside of medicine that you enjoy doing. And then your professional identity includes your mental well-being as well. So this is the final quote. Medicine is not just about what you know, it's about who you become. So every patient encounter is shaping your professional identity. So you should choose every day to be the kind of doctor that you would want caring for your own family. So when patients come to my office, you know, I try to carry myself and give my advice, recommendation, like they were my mom, right? So I'm not going to recommend something to a patient just because, you know, I need to do more surgeries or I just am really knife happy. I love to operate, but a lot of patients that come to my office don't need surgery. So from a digital perspective, when people are searching, let's say someone has neck pain and got a shooting pain down their arm, or, you know, back pain, knee pain, they need a hip replacement or knee replacement, what's the first thing they do? They go to social media, they go to Google, start searching. So when you guys get out into practice, it's going to be even more imperative to have some type of digital presence because that's how patients are searching. It may not be as important if you work for, let's say, a hospital that's feeding you patients, they're referring patients to you, or if you work for like an academic center, it may not be as important because you have you're really a huge internal referral system. But in general, as a physician's patients, they have to feel comfortable with you. They have to trust you. And I have patients that look me in my eyes like, Dr. Webb, I trust you. And that's a really good feeling. You're like, oh crap, they trust me. But it's a really good feeling because a lot of these patients, they do their research, right? What's the first thing they do when they get referred to a doctor? They look them up. And if they look you up, they want to make sure that, you know, they are compatible with you. So I have a lot of patients that come in that, like Dr. Webb, I feel like I know you because I watched every one of your videos. You know, I'm here because of your videos. And about 30% of my practice is travel patients, all because of social media. I had a patient this morning come in from New Mexico. I had a patient yesterday come in from Mississippi, a guy from Alaska recently, a patient from Georgia. And a lot of these patients, they'll come in and man, they're just like, Dr. Webb, I appreciate, I'm just honored to be here. I had a guy cry on me last week just because he just heard my story and just really inspired to kind of be at my clinic. So I think that's why it's important also to educate. That's the main reason I do is just to educate. I love teaching. And if you give something of value to people, people really appreciate that. And that's really helped propel my practice. So not everybody's comfortable on camera. You don't have to be on camera. You don't have to have a digital presence, but I think it's helpful as a physician. But you also, you gotta be mindful of what you're putting online. So you're applying to medical school, your social media accounts, you gotta maybe put those on private or delete them. People search, okay? When I look through applications, you know, we look through social media profiles and look at the applicant. Are they popping bottles at the club or, you know, doing crazy things online? Even though there's some doctors that do a lot of dancing. I don't know how to dance, so I don't do that. But what you put out online is really important. You have to check with your employer, with your hospital system to make sure that they're okay with you doing social media, because they may not want to have you have UT Health or University of Alabama in your shirt and you're making videos about it. Like, it could be something else, but you have to be just mindful of that. But having a digital presence can certainly help as long as it's done with that professional identity in mind and doing it for the right reasons. All right, just got done with my talk here at UTSA. I think it went well, and really small group, which I like, instead of a huge crowd and audience, which I've given talks to also. And hopefully the students can take away something and help them be a better doctor, better person, better student. So go Road Runners, let's go.